So, the case study learning from promising primary care practice model for the US is being conducted by Training and Research Support Center together with Robert Wood Johnson Foundation, which analyzes primary care models from Canada, specifically from Ontario and Quebec, with the goal to highlight the gaps of United States healthcare. 13 informal interviews with a mix of stakeholders and policy officials were conducted as a part of an exploratory case study approach that looked at the innovation and reform of the primary care system in two provinces. The primary care reform from the late 90s to early 2000s introduced various models such as family health groups, family health networks, nurse practitioners lead clinicals, and community health centers in Ontario. So, alongside with family medical groups in Quebec. Um, so, while evidence on the impact of these models is limited, it increased the number of primary care physician and patient enrollment. So it improved the access for vulnerable population and enhanced the standard of care. The study suggests that United States have several implications that requires increased funding, improved service accessibility, and focus on multidisciplinary care, which includes a broader range of service and payment enhancement to support extended hours and preventive health measures. So, the aim of this paper is to apply the three classical theories, which include the structural functionalism, conflict theory, and symbolic interactionism, into case study, and to deepen our understanding how this reform influence society and how diverse groups experience the primary care system. Using these theories, it will help us view how health system work on various levels that will allow us comprehend how structures support balance, power, and inequality influence decision. Overall, applying these theories can assist us gain a better understanding of strength, difficulties, and the profound impact of the primary care system. So I'll talk first about the structural functionalism. So according to Reveley and Weber 2022, they state that society is viewed as a system that is interrelated and interconnected, and helping people to fulfill their wants and desire. And according to the guidelines of social values and looking at the functionalism through the lens of how ASARI 2024 described the healthcare in the US and how it's failing its people, it can be seen that a call for reform of adapting the healthcare system in Canada cannot just fix the issue in the US healthcare system, as there are several factors and issues that promote systematic inequalities in the United States. First one is the high medical costs that according to research affect 1 in 4 Americans and hinders them from accessing medical services, as well as prescription medication. And research further indicates that structural racism and bias heavily contributed healthcare inequality. ASARI 2024 also stated that it is commendable that the healthcare in Canada is being used a framework for the US to adapt Canada's system as interrelated part as well. However, they all work together to facilitate and make the system better for its citizens and residents. Mott and his colleague 2014 highlighted how functionalism has helped to understand why reforms are needed and how new primary care models provide stability in society. According to Reveley and Weaver 2022, structural functionalism sees society as a team that work together to maintain stability in society. However, if one part of the system fails, it can produce dysfunction. So, through the lens of American University of Antigua 2025, it highlighted the healthcare function of two countries, indicating that in Canada's healthcare system provides all-inclusive accessing and focusing on preventive care for better health outcomes for each citizen. This proven by the fact that life expectancy in Canada is about 80 years and infant mortality is lower compared to the US. Given that prenatal and postnatal care are accessible in Canada. However, limited resources is one of the obstacles in Canada due to the long wait for specialists and certain treatments. Whereas in the United States, healthcare provider has a faster access to specialists and more advanced treatment. Patient can often schedule a specialist within a week rather than waiting in a month. But their healthcare depends on insurance coverage and a person's ability to pay, which result in inequalities. The life expectancy of United States shows 77 years lower than Canada, and one of the reasons for this is inequality in accessing treatment, especially chronic illness. Overall, this shows that two countries has different approach. While in Canada is improving, the United States on the other hand struggle to produce inequalities leading to dysfunction and instability. So talking about conflict theory as well, it emphasized that power is the main factor in all social relationships. It is scarce that divided unequal toward societal members. This leads to those who are powerful within society gain superiority over those powerless. According to the case study Mott et al. 2014, and through the lens of conflict theory, the difference between the healthcare in Canada and the United States can be seen from how power dynamics play major role. It shows how everyone gets equal treatment in Canada, which is not as privilege but a basic right. This reduces power instability towards the rich and poor, as accessing to services is not dependent on a person's income or employment, but rather a human being who needs help. Furthermore, Caring Support 2025 pointed out that people with power, especially economically and politically, have better access to resources and health outcomes. It stated that United States does not have universal healthcare system and that almost 20% of adult citizens does not have insurance. And most of citizen access medical care rely on employment status through their job insurance or the capabilities to pay for it. This situation implies that major insurance providers together with wealthy people continue to control healthcare resources, while low income and unemployed people struggle to obtain basic treatment. And the third theory is the symbolic interactionalism. This theory explores society by exploring how it is constructed through everyday encounters and how meaning emerge from people's behavior. Symbolic interactionalism argues that society is not naturally occurring, but rather it is created, defined, and altered through daily interaction. Symbolic interactionalism are being emphasized based on the case study by Mott et al. 2014, stating that daily interaction can shape a broader outcomes, efficient satisfaction, and overall efficiency of a primary care system. According to Budhwani and D 2019, individuals of color in the United States experience a stigma, particularly within healthcare environments. Previous research has shown that people encounter discrimination and stigma throughout several aspects of their lives, such as in their workplace, community encounters, and healthcare environment. This experience has profoundly impacted them, particularly on their physical and mental health well-being, through reduced access to care, delayed or postponed treatment, and possibly feeling of unworthiness and sense of belonging. The more demographic factors also influence stigma against them, including their age, sexual orientation, civil status, as well as socioeconomic status. These factors affect how interaction is on daily basis and how their concerns are being handled seriously and how much respect they receive. Overall, the case study by Mott et al. 2014 demonstrated how the Canadian primary care model provides a valuable lesson that could help address the gap in United States healthcare, specifically in terms of accessibility, interdisciplinary teams, and the support for marginalized populations. Applying the three classical theories, including the structural functionalism, conflict theory, and symbolic interactionism, we gain a deeper understanding of how reform function within society. Structural functionalism have been used to understand how Canada is universal and preventive, which supports stability, while United States on the other hand suffers from dysfunction via high costs, insurance barriers, and unhealthy outcomes. Conflict theories show how power and stability influence healthcare and accessing, revealing that Canada treats as basic right and not a privilege, whereas United States reflects how a person's ability to pay for it and with their insurance. Symbolic interactionalism also displayed how daily interaction in healthcare shape trust, patient satisfaction, and the health consequence, especially for people of color who experience stigma and discrimination several aspects of their lives. In summary, these theories demonstrate that healthcare reform is about understanding how support, power, and everyday interaction influence lives of every individual within a society. Thank you.